Hello, my name is Dr. Kevin Mercado. I'm here to show you the second part of the CPR series, which is how to perform CPR on an adult mannequin. So the first thing you're going to do before you perform CPR in a situation where someone collapses on a track is to check the scene for safety. So your safety is number one priority. So if the scene is not safe, you would not enter to assist. You basically would just call 911 immediately and wait for help to arrive. If the scene is safe and somebody did collapse, the first thing you would do would be to go to the individual's shoulder and begin to check for response. So the first thing is, are you okay? Are you okay? No response. Basically, then you would summon somebody to call 911, or you would attempt to call 911 yourself if there's nobody else around you. No response, then I'm going to scan for breathing. I can't perform CPR until I know that they are not breathing and that I would suspect that they don't have a pulse. So I'm going to scan for breathing. I'm going to look for the stomach to rise. I'm going to look for the chest to rise. If I see no movement at all, and I can even try to listen to see if I hear breaths. If I don't hear anything and I don't see any movement and I suspect that they're not breathing and don't have a pulse, I would immediately begin CPR. So what I've done is I've replaced a human person with an adult mannequin in order to teach you how to properly perform CPR on an adult mannequin. What I've done is, I mentioned before in a previous video that I've provided a face shield for you. So the face shields are very important to be able to protect yourself when performing CPR. There's a little prong, we'll call it a prong, on the back side of the face shield. This is the back side, so this actually gets placed inside the mouth. Now, what I can do now when I am about to perform CPR is I can remove my own face covering, and I will immediately begin compression. First thing, 2 hands on the middle of the chest. You're gonna find where you would perceive the nipple line to be, and you're gonna cut it in the middle of that. So you're gonna place your first palm right in the middle of the chest, and your other palm is gonna be right over the first hand. Better to keep your fingers off of the body, not on it. It's better for your compressions. You're gonna have 2 knees on the side of the body. Shoulder and elbow and wrist are in the same line. They're not at a slant, they're directly over in order to allow you to perform compressions effectively. Then what you're going to begin to do is compress. Now it has to be a hard compression, it has to be a deep compression. So what you're gonna do is you're gonna begin your compressions pretty deep, okay, pretty hard. 1, 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 12, and 13, and 14, 15, and 16, and 17, and 18, and 19. You're gonna do 30 of them, and 2, and 3, and count out loud. And 6, and 7, and 8, and 29, and 30. Those are your compressions. So to review just very quickly, it's a hard compression, it's deep. It's a lot of times, a lot of people have said that don't be afraid to understand that you may break a rib or a sternum or whatever it might be when you're compressed. So it's got to have to be a hard, forceful compression in order to allow the heart to continue to beat manually. Once you complete the 30 compressions, you're going to begin to do 2 breaths. So your right hand, for example, the palm is on the forehead. You're going to pinch the nose. You're going to put your other hand underneath the chin, and you're going to tilt the head. The head has to be tilted in order for the breath to enter. You're going to put your mouth completely over the face shield. And you're going to give 2 breaths. When you give the breaths, you'll be able to see, if they're effective, you'll be able to see the chest rise on the mannequin. So let me repeat that again. Watch the chest rise. Then you'll return to 30 compressions. Now, with the compressions, if the mannequin is done, if the CPR is performed inside, the mannequin actually does have lights that will light up here. A red light indicates it's not an effective compression. A yellow light means that it's effective compression, but it needs to be a little faster. It's like the yellow light on the stoplight. And the 2 green lights means that the compressions are effectively being performed. That completes my CPR adult mannequin demonstration on how to perform CPR effectively.